Hi everyone, I'm Eric Sundberg. I'm a spine surgeon at Coastal Orthopedics, and I'm going to talk to you about cervical fusion versus a disc replacement, kind of the new versus the old here. Fortunately, I don't have any conflicts, so I have no disclosures to discuss. So, a cervical fusion is what we call an ACDF, which you may or may not have heard this term. It's an acronym for anterior cervical discectomy fusion, and it's typically been considered the gold standard for treatment of cervical problems, or for many cervical problems. And we've called it the benchmark surgical intervention to decompress and stabilize the spine. So if you have a pinched nerve or some type of motion abnormality, this is often what we're using to treat you. There's extensive evidence over the years that many of my colleagues have developed that show excellent results with this procedure compared to other interventions, and even compared to interventions that we know are really good in other parts of orthopedics, like hip replacements. So, now an ACDF can look very different from one patient to another, so it's always something that if you've heard of someone having one, what is being recommended for you may be very different, because you could have an ACDF of many different levels in the neck that also requires fixation in the back of the spine, or you could have a small implant where there's really no plate and screws, just a little cage with a couple screws going through it. Or maybe something in between, like up here on the upper right part of the screen, where there's a plate and screws, but also bone in between that gets the vertebrae to fuse together. So it can mean many different things. It's a very versatile operation. But it still fuses the spine, and that means we get the bones to grow together. And one thing that happens when the bones grow together is you lose motion at that segment. And the other thing that happens is because that motion segment is no longer moving, it puts more stress on the levels above and below. And so we've known about this problem for a long time, and we know that the levels above and below will degenerate, and it's almost 3% per year. And so that means that every year there's a 3% chance that that next level could have a problem. And so in order to try to prevent that, people have come up with something called a cervical disc arthroplasty, or cervical disc replacement. And the goal is to preserve motion, to improve outcomes, and then hopefully decrease the amount of stress on other levels in the neck. So what do we do these procedures for? Well, most commonly it's some type of what we call cervical spondylosis, which is kind of like arthritis of the spine or degenerative changes of the spine. It's ubiquitous, and it's a consequence usually of aging. And some of us have it, and we just don't even know about it because it's not causing any pain. Other times it does cause pain, and it could cause pain in the neck, could cause pain going down the arm, which we call radiculopathy. Or if it's pinching on the spinal cord, it could cause like a disease of the spinal cord that can affect your arms, and numbness and tingling and even balance and coordination. So indications for a cervical disc arthroplasty or a disc replacement include failed non-operative management. So usually we start by trying things like physical therapy or injections, and if those things don't work, then sometimes this disc arthroplasty is an option. We can use it for up to 2 levels in the neck. If there's more than that, then we have to start considering either usually like the ACDF or fusion options. And then there's a number of reasons why we can't do it. So not everyone is a candidate for it, but many people are. And so indications for cervical disc arthroplasty or disc replacement include failed non-surgical treatment of the problem. So normally we start with things like physical therapy or injections, and if you just don't respond or it's not helping, that's when we start to consider surgical intervention, including the possibility of a disc replacement. And it has to be only 1 or 2 levels of disease. If it's more than that, usually we're talking about a cervical fusion. There are a number of contraindications. They're listed here. For example, if you have 3 or more levels of a problem, or there's some type of instability in the neck. But many people are a candidate for disc arthroplasty. Right now there are 7 total disc replacement options available in the United States that have FDA approval. Most of them are some type of combination of either cobalt chrome or titanium with what we call high molecular weight polyethylene, which is like a real special surgical grade of plastic. And again, the point of this is to retain motion in the spine. So these surgeries are done through a small incision in the neck. It's actually a very cosmetic incision. Whether we all want to believe it or not, we all have some wrinkles in the front of the neck, and so we can usually hide those incisions very well. And because the skin is kind of very flexible in this area, they usually heal very well. And so we make a small incision on the front of the neck. We're actually able to dissect down to the spine with very little to no muscle damage at all. And then basically what we do is we remove that diseased disc in the cervical spine, and then we replace it with the disc replacement. Usually the surgery takes somewhere in the order of 45 minutes to an hour if you're just having a single level done. And the good thing is we now have a lot of evidence that people do really well with this procedure. So there have been 7 FDA-approved disc replacements, as I talked about earlier, and all of them have supporting level 1 evidence, and we can put all that evidence together. And in general, it's shown that disc replacements are at least as good as the ACDF, which I had said earlier was the gold standard. And many of these studies show improved outcomes of disc replacement when we're comparing it to a cervical fusion. The other thing I had mentioned a little bit earlier was this adjacent segment disease, or the disease of the next segment above or below in the cervical spine. We know that happens, and we can see that here on the x-ray. This is a big bone spur on the front above this level that was fused. And then the same thing happened at the level below, because we know when this level's not moving anymore, there's more stress above and below. And so we're still kind of exploring as to whether or not this happens after a disc replacement, but there's at least some evidence showing that it happens at a lesser rate. This is a cost-effective procedure, and you may be asking, well, why are we talking about this? Well, with this day and age, insurance companies are driving what we can and cannot do a lot, and so we have to prove that these are cost-effective procedures and that it's worth the outcomes are worth the cost of the procedure, and this has been established in multiple studies showing this is a very cost-effective procedure. There are complications with this procedure, like every procedure, and your surgeon will have to talk about this. Very rarely you can see things that are like a prosthetic failure, which means the implant actually failed, or there was some migration, or what we call subsidence when the implant migrates into the bone. And then there could be wear, where the disc replacement wears out. These things can happen, but the good news is most of the studies show it's very low complication rate. So in conclusion, there's a lot of high quality evidence that supports the cervical disc arthroplasty or cervical disc replacement. There is some conflict of interest of the evidence, because obviously a lot of this was funded by the device companies. But that being said, most of it's level 1, so it's still very good evidence. I'd say the jury is still out as to whether or not we're seeing reduced rates of these problems at the levels above and below in the cervical spine, but there is some promising evidence that it's going to be lower. And so we talked about the indications for the disc replacement, and as it becomes more common, I expect that some of those indications will actually broaden, and that more people may be a candidate for this procedure. So we still have limited data. You know, we have very good kind of 10 to 12 year data, but obviously every year that we collect a little bit more. And so overall, I'd say this is a very exciting and promising new technology that in general we are using more and more. So thank you very much. Please feel free to call us, 941-792-1404, if you have any questions about your neck or disc replacement or any other spine problems or orthopedic problems in general.